Hello everyone, I am Dr. Deepa. Today we are here to learn about the topic the paranasal air sinuses. The sinus word refers to the space containing the air. The paranasal air sinuses are nothing but the air containing bony spaces which are present around the nasal cavity. As the name says, paranasal, that is, these are the bony spaces containing the air located around the nasal cavity, and these paranasal air sinuses are mainly covered by the mucous membrane. They are covered by the mucous membrane, and all the mucous membrane of these air sinuses are lined by the ciliated columnar epithelium. So the lining epithelium of this paranasal air sinuses is the ciliated columnar epithelium. So this is about the mucous membrane and the lining epithelium of the paranasal air sinuses. So in total there are about 4 pairs of the paranasal air sinuses which are arranged around the nasal cavity. As we can see in this diagram, the 4 paranasal air sinuses, pair of paranasal air sinus include the frontal air sinus, number 1. Next comes the ethmoidal air sinuses, the sphenoidal air sinus, and the maxillary air sinus. Among these 4 paranasal air sinus, the largest of all is the maxillary air sinus. So maxillary air sinus is the largest paranasal air sinus among the all. We will look on to the location of the paranasal air sinuses one by one. Before dealing in detail about the individual air sinuses, we'll just have a brief note about the functions of the paranasal air sinuses. So what is the use of this paranasal air sinus, or the functions of the paranasal air sinuses is mainly, number 1 is the paranasal air sinuses act as the air conditioning chambers. Yes, they act as the air conditioning chamber as the contained air within the sinuses adds humidity and temperature to the inspired air, thus acting as the air conditioning chambers. So this is the very first function. Number 2, the paranasal act as the resonating chambers as well. They act as the resonating chambers. They act as the resonating chambers for the production of the sounds, Number 3, as the paranasal air sinuses are present within the facial skeleton, they make the facial bones lighter. They make the facial bones lighter and establish the adult counter of the face, thus help in the establishment of the adult counter of the face. So these are the primary functions of the paranasal air sinuses. That is, the sinuses act as the air conditioning chamber, they act as the resonating chambers, as well as they are mainly responsible for the light nature of the facial bone. So this is about the prime functions. Moving on to the paranasal air sinuses one by one. To begin with, the frontal air sinus. Normally, all sinuses are developed in rudimentary form at the birth. It is the frontal air sinus. It is the frontal air sinus which is not seen at the time of birth. That is, the frontonasal air sinuses begins to develop around 2 to 3 years after the birth. Yes, the development of the frontal air sinus is about, it develops about 2 to 3 years. The development of this frontonasal air sinus begins 2 to 3 years after the birth of the infant. So this is about the development of the frontal air sinus, which is the exceptions, whereas rest all sinuses are seen in their rudimentary form at the time of the birth. This frontonasal air sinus, as the name itself says, they are two in number on either side and they are present within the frontal bone. So the exact location of this frontonasal air sinus is between the two tables. So the location of this frontonasal air sinus is between the two tables of the squamous part of the frontal bone. So they are located within the squamous part of the frontal bone. They are located within the squamous part of the frontal bone. So this is about the location of the frontal ear sinus. So they are located between the two tables, within the two tables of the squamous part of the frontal bone, and exact location is that it is deep to the medial end of the superciliary arch. So they are located deep to this medial end of the superciliary arch, above the superciliary arch as shown here. So this is the location of the frontal air sinus. This frontal air sinus is seen to communicate and open into the middle meatus of the nose through the ethmoidal infundibulum. So this is about the frontal air sinus. This air sinus is seen to have its blood supply from the supraorbital vessels as well as the nerve supply from the supraorbital nerves. The lymphatics from the sinus drains into the submandibular group of lymph nodes. So that's all about the frontal air sinus. So we have studied about the location of the frontal air sinus, the embryological development of the frontal air sinus. We have studied about the blood supply, the nerve supply, and the lymphatic drainage of the frontal air sinus. Moving on to the very next, that is the ethmoidal air sinus. The ethmoidal air sinus are in total are around 5 to 15 in number as a whole. The ethmoidal air sinuses, they are about 5 to 15. They are about 5 to 15 in number, and the arrangement of ethmoidal air sinuses is in the form of three groups, that is anterior, middle, and the posterior. So they are arranged in the form of three groups, that is anterior, middle, and the posterior ethmoidal air cells. So these is ethmoidal air cells, ethmoidal sinuses, they are located between the medial wall of the bony orbit and the lateral wall of the nose. I repeat, the location of this ethmoidal air sinuses here, the location of the ethmoidal air sinus, as we can see here in the frontal view, it is between the lateral wall of the nose and the medial wall of the orbit. So this is about the location of the ethmoidal air sinus, and it is contained within the labyrinth of the ethmoidal bone. So they are formed within the labyrinth of the ethmoidal bone between the lateral wall of the nose and the medial wall of the orbit. So this is about the ethmoidal air sinus. The ethmoidal air sinuses have received its vascular supply from the anterior and the posterior ethmoidal branches coming from the ophthalmic artery, as well as the lymphatic drainage is onto the submandibular group of lymph nodes. So the lymphatic drainage of the anterior and the middle is same as that of the frontal, reaching the submandibular group of lymph node, whereas the posterior ethmoidal air cells, the posterior ethmoidal air cells drain, the posterior group drain into the retropharyngeal group of lymph nodes. It drains into the retropharyngeal group of lymph nodes. So this is about the lymphatic drainage. Next, moving on to the maxillary air sinus. The maxillary air sinus, which is the largest of all the ethmoidal of all the air sinuses. This is the atlas view. the sagittal section, where we can clearly make out the presence of the paranasal air sinuses. In this view, we can see the location of the frontal air sinus. As I have told, the frontal air sinus is located between the two tables of the squamous part of the tempo of the frontal bone. We can also make out the location of the maxillary sinus here. In this view, we can make out the location of the ethmoidal air sinus. The ethmoidal air sinus, as I have told, they are around 5 to 15 in number. They are small air cells, about 5 to 15 in number, and they are arranged in anterior, the middle, and the posterior ethmoidal air cells. These ethmoidal air cells, they are located medial to the lateral wall of the nose. So this is how the ethmoidal air cells are arranged. We can also make out here the maxillary air sinus. The maxillary air sinus is the largest of all the paranasal air sinus. It is the largest of all the paranasal air sinus, and this maxillary air sinus is somewhat pyramidal in shape roughly. So the maxillary air sinus has got the apex, it has got the base, it has got the roof and the floor. So when we talk about the apex of the, here we can see, and when we talk about the apex of the maxillary air sinus, the apex of the maxillary air sinus is directed towards the zygomatic process of the maxilla. So this is the apex. The apex is formed by the zygomatic process of the maxilla, whereas the base is opposite to that of the apex, as we can see here, the one which I have highlighted. The base is formed by the nasal surface of the body of the maxilla. So the apex is formed by the zygomatic process of the maxilla. The base is formed by the nasal surface of the body of the maxilla. The roof of this maxillary air sinus is formed by the orbital surface of the maxilla. The roof is formed by the orbital surface of the maxilla, whereas the floor is supported by the alveolar process of the maxilla. So this is how the maxillary air sinus is located. So this largest paranasal air sinus, that is the maxillary air sinus, is located within the body of the maxilla, and it is limited above by the orbital surface of the body of the maxilla. Below, or the floor, it is formed by the alveolar aspect of the maxilla. The apex is directed laterally and is formed by the zygomatic process, and the base is formed by the nasal surface of the maxilla. So this is about the formation and the location of the maxillary air sinus. The maxillary air sinus is seen to receive its blood supply from the anterior, middle, and the posterior superior alveolar vessels of the maxillary artery. So the blood supply is mainly from the anterior, middle, and the posterior superior alveolar vessels, and the lymphatics of all the maxillary, both the maxillary air sinus, drains into the submandibular group of lymph nodes. It drains into the submandibular group of lymph nodes. To remember, the lymphatics from the frontal air sinus, the anterior and the middle ethmoidal air sinus, as well as the maxillary air sinus, is seen to drain into the, they are seen to drain into the submandibular group of lymph nodes, except the two, that is sphenoidal air sinus and the posterior ethmoidal. The sphenoidal air sinus and the posterior ethmoidal air sinus drains into the retropharyngeal group of lymph nodes. These two drain into the retropharyngeal group of lymph nodes. So this is about the maxillary air sinus. Next, we'll just have a look about the areas of drainage of, or the openings of these air sinuses. The opening of the air sinuses, as we can see here. Yes, this is the lateral dissection showing the maxillary air sinus. As I have told, the maxillary air sinus is limited by the apex, the base, the roof, and the floor. The apex is directed towards the zygomatic process of the maxilla as seen here. The base is formed by the nasal surface, which is very well appreciated over here. The roof is formed by the orbital surface of the maxilla, and the floor is limited by the alveolar process of the maxilla. So this is how the maxillary air sinus is formed. Now next, moving on to the sphenoidal air sinus. The sphenoidal air sinus. This sphenoidal air sinus is located within the body of the sphenoidal bone as seen here. So the sphenoidal air sinus is located posteriorly, hidden deep to the body of the sphenoid. So it is located deep to the body of the sphenoid, above and behind the nasal cavity. It lies approximately above and behind the nasal cavity, and this sphenoidal air sinus may be seen to extend up to the anterior margin of the foramen magnum. It may be seen reaching up till the anterior margin of the foramen magnum. So the sphenoidal air sinus receives its blood supply from the posterior ethmoidal vessels, and the lymphatics drain into the retropharyngeal group of lymph nodes. The nerve supply is also from the posterior ethmoidal vessels, the nerve coming from the pterygopalatine ganglion. The nerve supply is from the posterior ethmoidal nerve coming from the pterygopalatine ganglion. So this is about the sphenoidal air sinus. So this is the location of the sphenoidal air sinus, as we can see within the body of the sphenoidal bone. Next, after looking onto the locations and the blood supply, nerve supply, lymphatic drainage of all the air sinus, we'll just have a look on the openings of these paranasal air sinuses. Yes, the paranasal air sinuses opens into, are seen to open, or they are seen to drain into the lateral wall of the nose. So the lateral wall of the nose receives the opening of all the paranasal air sinuses, as we can see in this picture shown in different shades of colors. The red indicates the frontal air sinus, which opens into the middle meatus of the nose of the lateral wall through the frontonasal duct. The next is the opening of the superior the next is the opening of the sphenoidal air sinus, which is seen to open into the sphenoethmoidal recess above the superior concha. So we can see the opening of the the sphenoidal air sinus into the sphenoethmoidal recess. The maxillary air sinus opens into the hiatus semilunaris of the middle meatus. Among the three ethmoidal air sinus, the anterior ethmoidal air sinus opens into the hiatus semilunaris of the middle meatus. The middle ethmoidal air sinus opens into the ethmoidal bulla of the middle meatus, whereas the posterior ethmoidal air sinus is seen to open into the superior meatus. So this is about the area of drainage of the respective air sinus. So this is the diagrammatic view showing the openings of all the paranasal air sinuses, the one which I have mentioned. So the maxillary air sinus, which is the largest of all, opens into the hiatus semilunaris. The maxillary air sinus opens into the hiatus semilunaris present in the middle meatus. The ethmoidal air sinus, that is the anterior and the middle ethmoidal air sinuses, opens into the middle meatus, whereas the posterior ethmoidal air sinus is seen to open into the superior meatus. So out of the three ethmoidal air sinus, it is the posterior ethmoidal air sinus which opens into the superior meatus, whereas the anterior and the middle is seen to open into the middle meatus. The sphenoidal air sinus opens into the sphenoethmoidal recess of the superior, above the superior concha, and the frontal air sinus is seen to open into the middle meatus through the frontonasal duct and the infundibulum. So this is about the openings of all the paranasal air sinuses. So before winding up with the paranasal air sinuses, we'll just have a note about the clinical importance of the paranasal air sinuses. The paranasal air sinuses may be infected and there may be the accumulation of pus within the sinuses. So, this infection of the paranasal air sinuses can be detected by the radiological examination and also the test called as the transillumination test. The sinus which is more prone for the infection is the maxillary air sinus, as the maxillary air sinus is the most dependent part and acts as the secondary reservoir of pus from the infected sinuses like frontal and the ethmoidal sinus. The maxillary sinus is also directly infected from the caries tooth. So the drainage of the pus has to be done. Surgical drainage is made by breaking the lateral wall of the middle meatus or through the canine fossa on the anterior surface of the maxilla. This is about the surgical treatment mode of the sinus infection. Sinuses involving the infection which is called as the sinusitis. So this is all about the anatomy and the clinical importance of the paranasal air sinuses. Thank you.